which is about public health, rising obesity, and Prime Minister talking about it, saying reduce oil consumption.
हमारे देश के हर परिवार को चिंता करनी चाहिए। मोटापा हमारे देश के लिए बहुत बड़ा संकट बनता जा रहा है। आने वाले वर्षों में लोग, जो पंडित लोग हैं वो कहते हैं, जो जानकार लोग कहते हैं, हर तीसरे व्यक्ति में एक व्यक्ति मोटापे का शिकार होगा। हमें मोटापे से बचना है, ओबेसिटी से बचना है, और इसलिए मैंने बाकी सब करना पड़ेगा, लेकिन एक छोटा सा सुझाव दिया था कि परिवार तय करे कि जब खाने का तेल घर में आएगा 10% कम ही आएगा और 10% कम ही उपयोग करेंगे, और हम ओबेसिटी के खिलाफ लड़ाई को जीतने की दिशा में हम अपना योगदान देंगे।
Let me straight away go to Dr. Shikha Sharma, founder One Health and Veteran Nutritionist. Madam, my straight question, why has oil consumption jumped in this country? What Prime Minister has been saying is like a push for a healthy India. But why has oil consumption jumped so much, madam?
See, the fundamental reason why oil consumption has jumped is because of rising income, where people can afford oil. There was a time when people could not afford oil, and therefore the oil consumption was very little. But today, because of rising consumption, people are able to afford oil and they are using it very liberally. That is one of the biggest reasons oil consumption has gone up.
One reason you say because people can afford it. But are you saying that the people are consuming more oil in their vegetables, more oil in the meat? I mean to say, oil as a medium of cooking has existed for thousands of years.
Yes. See, oil was always sparingly used because it was an expensive commodity, number one. Number two, because it was expensive because the general income was very low. Now with rising incomes, people have what they call as discretionary income. Now that discretionary income is being used to have more oily food, use oil liberally in their food, and also consume a lot of what we say is convenience food, what in layman language is called junk food, fast food. So this rising income has gone towards consuming more oil and more convenience foods.
So, madam, is it because of the fact that people are consuming more oil because they are, cooking food in their kitchens with larger amount of oil, or are they consuming it through processed food, chips, other things which a lot of people say use industrial oil, seed oil, which is not good oil, and it's all becoming part of your diet because of this habit of snacking, high calorie, dense food?
Absolutely, both, actually both. And I would say that the oil consumption at home has gone up, but the bad oil consumption, which is called the chemical oil consumption.
What is a chemical oil, madam? I think you should tell people, what is chemical oil?
Yes. So what happens, suppose if you look at kachi ghani or cold pressed oils, the traditional way where seeds were crushed and oil was extracted. Now that oil is healthy oil because it has essential fatty acids, which is important for our brain, for our nervous system, for our hormones. The chemical oil is refined oil. In the refining process, a lot of chemicals are used to extract the oil. It is not this crushed oil, crushed seeds, but chemicals are used to take out the oil from the seeds. Now these chemicals stay in the oil. They don't completely come out. And because they stay in the oil, ultimately that oil and that chemical is going inside the body and disrupting our entire hormonal system, causing inflammation, causing visceral fat. So all today what you see that, a lot of people would say that Indians have bad genes. And I disagree. Indians do not have bad genes. Indians have fantastic genes. It is the chemicals in the oil, chemicals in the fast food, which is actually disrupting our hormonal system, disrupting our gut biome, disrupting our entire digestive processes and giving us diseases like diabetes, like cancer, like hormonal imbalance.
Like, for example, the Lancet study that has come that 1 in 4 Indian does not know that they have diabetes. 4 in 10 diabetics in India are unaware of their condition. So, I mean, so we can blame our lifestyle, we can blame, stressful job conditions, but it is also because of the fact that the sort of food which people are eating, isn't that, madam?
Absolutely. Like if you see, look at any grocery store, it is full of packaged food. And these are packaged foods which are all containing chemicals. Now, all these chemicals, where are they going? They're going into our liver, into our kidney, into our brains. So it is disrupting our entire digestive system.